I want to welcome our listeners back to Common Sense Medicine. This week, we'll be touching up on ADHD. Now, this is a two-part episode that is a continuation of last week's episode. So if you've not heard last week's episode, I strongly encourage you to go back and check that out, and then check this out. But with that being said, we're going to go ahead and get right into it. This is as good as any time to focus on our, ADHD. Diagnosis of ADHD has gone up significantly. Mm-hmm. But interestingly enough, I was doing some research more in the United States than in any other country, which is kind of funny. You're always like, why are we always more, but not always more in the good thing? And, there's multiple reasons. But that's essentially what we want to focus a lot of our time on today, because ADHD now has become such a hot topic. There's a lot of places, like you said, telehealth will test you. Back in the day, it was these 3-hour-long tests where you're testing all sorts of things. Now it's mostly just a questionnaire. And so, today talking about ADHD, we'll be talking about a couple of things, like A, what's the current situation in the United States right now? Maybe B, why is it becoming such an issue? Did something change in our environment? Obviously, I just tossed it up for you to spike it, Melissa. And then what we've observed in our clinic, because we see obviously patients from different ages and different generations. What have we noticed? And then we'll talk about obviously treatment. And then we'll talk about maybe things that we can do beyond pills that can really help. And the reason we bring this up is because, when I travel in Asia, and I actually went to school a little bit in Asia, you realize their approach is very different, on how they combat attention issues. And obviously they don't have as much ADHD, or maybe not as much diagnosed, but, how do they combat that? How do they compensate for things like that? And obviously as technology creeps in, that'll become a bigger issue. So this will be a fun episode. Yeah. Melissa, let's start there. Pre-pandemic, we had ADHD.
Yes.
Post-pandemic, way more ADHD.
Yes. Yeah, we kind of looked up a few statistics. So just between 2018 versus end of 2021, the amount of adults that were diagnosed with ADHD, and this particular study spoke strictly on Adderall, generic and brand names. So there are other medications for ADHD that are also stimulants, but the Adderall was really looked at in this one. And so for adults ages 22 to 44, there was a very large uptick from about 900,000 prescriptions for Adderall prescribed in 2018 to about 1.3 million by the end of 2021, which, we're even a full year after that. So I can only imagine that it's probably even higher now. And so, we kind of look at why would there be such a big uptick in Adderall prescriptions in the past couple of years. Part of that is because the way we live life is a lot different because of a pandemic. A lot of people were sent home for work. A lot of people stayed home and are still at home.
Yeah.
So the option to work at home, to do school from home, to grocery shop from home, you can kind of do all of this stuff kind of on your own time and on your own schedule. But that can kind of have a downside. You don't have anybody saying you have to do this by a certain time. You don't have to be in a certain place at a certain time. You really have to build your own schedule. And for some people, that can be really hard.
Yeah, no, you're exactly right. And, and we bring this out all the time, so speaking of the obesity epidemic, one big issue with the obesity epidemic is because of the environment change. White refined flour, white refined sugar, high fructose corn syrup, all these things came on to the scene, and that has really contributed, to the obesity epidemic. But we never consider that, yes, our life is actually different than it was even back in 2000, and how that affected the ADHD. I guess it's epidemic now, because you're right. Look at that kind of growth. It's not like all of a sudden everybody's genetics changed and we had more, but it's like, maybe our life is very, very different. And I like what you brought up. The first thing from the pandemic side was working from home. And so, when I went to, and even I guess growing up, when I went to Asia and went to school, school starts at 8. Everybody's desk is facing the front. teacher has a giant chalkboard and they just train you to focus because they make structure for you, right? And even when we were growing up, Melissa, I watched Darkwing Duck at 4:00 getting off the bus, right? But at 4:30, it ended. And guess what? There is no more. And so you can either stare at commercials and watch something that you don't want to watch, or it's time to go out and play. Or, in our house, it's time to play piano or it's time to do schoolwork. But my parents made schedules for us because, that's just how it was. And even you think about, culturally, back in the day, everybody got together at dinner time. It's 6 p.m. Everybody sat down and ate. And even, there wasn't like soccer and, there was that, but it wasn't like it is today, right? We didn't have smartphones. No. We didn't have streaming. We didn't have all these things constantly trained to pull our attention away. And so maybe it was a little easier to focus. But now you add all that in, and it's not so easy anymore.
Right. And those changes have been pretty recent. We're about the same age. In high school, we were just starting to get cell phones. I think by maybe like senior year, everybody started getting the Nokias.
Yes.
But I mean, that was all you had as far as, technology that you took around with you. And then by college, I remember people started texting, back when you had to like push the button 3 times to get the right letter and all that. The people of today have no idea.
No idea, girl.
But I remember thinking like, why are people texting? You can just call. And now it's like, nobody call me. Okay. But I mean, in reality, so in all seriousness, now even if somebody is sitting in class on schedule, all that, they're getting notifications, not only from text messages, but from all the hundreds of apps that are on their phone. It's telling them, this, app is telling you one thing. Another app is telling you your Amazon order shipped, all of that, so it's everything has a notification and it's all going to come to your phone, whether you are in class, at work, driving. There's so many distractions. And even if you leave your phone in your bag, now we wear watches that make sure that we don't miss our notifications on our phone. Yeah. So, just the technology, and that's been just in the past 15 to 20 years, just the rapid evolution in how distracted we are.
Yeah. In fact, I saw a study talking about the average attention span of an American human being right now, and it's 7 seconds. And unfortunately, a goldfish is 7.4. So, so right now, us as human beings, we cannot focus longer than a goldfish.
No. And even my dog can like bring me the same ball for an hour over and over and over. I'm like, are you tired of this yet? But yeah, we can't even stay with one activity.
Correct.
For more than a few minutes, a few seconds.
Yeah. And I'll tell you, it's so funny. I mean, even I find it in myself, like we were watching Chopped on YouTube TV and and our commercial break, popped up. My kids were freaking out, like, skip the commercial, but you can't skip the commercial, which again, they don't understand. Back in the day, it would be 5-minute commercials. They were running the bathroom because if you come back, you miss it. You might miss a rerun. But okay, so it's, this 2-minute commercial. And I'm sitting there and I find myself pulling out my phone and scrolling Twitter. And I distinctly thought like, can I not really just sit here and be quiet for 2 minutes? That I have to really get my phone and check a message board or check Twitter, not knowing that nothing really changed in 2 minutes. But it's that. And I think the point I'm bringing out is that's not ADHD. That's just life.
The life that we live in now.
Exactly.
Yeah, which is a lot different than it used to be.
Oh, absolutely. Yeah. And, and speaking of, life and like you talked about us growing up, we've noticed that in our patient population in generations. We'll get some of our patients that are in their late 50s and 60s, and we'll go in the room and start talking to them, and you realize they don't have a phone on, their phone's somewhere in their jacket. It might still be a flip phone, and they're perfectly content sitting there just looking at, because we have some like, educational things on our screens when we talk to them. They're perfectly cool sitting there for 5, 10, 15 minutes looking at the educational things on the screen while we're, getting in there. Whereas then you go to somebody our age group you know, 15, sorry, 15. I wish I was 15. No, the 35 to 40 age group, and they might have their phone up, but the moment we walk in, they put it down, you know. And then you talk to some of our 20-year-olds and you go in there, they have their phone on. They might not even look up the whole time you're talking. And it's just interesting watching that happen.
Oh, yeah. And much more likely to check that notification if their phone does buzz, you know, during the visit. They're less likely to wait that few minutes to check it once the visit is over. They'll go ahead and check it while we're talking. Whereas, older generations, if they happen to hear their phone buzz, they're, very apologetic. Oh my goodness, I can't believe I have that thing in here, or it's still on, or whatever the case may be. Or they don't even acknowledge it and continue with the visit without any interruption. But just the fact that, as you kind of see the generations, the younger and younger people are definitely tied to that technology even more because that's what they've known their whole life.
Correct. So when you have, like, let's say I'm trying to do my homework and, I'm at home because it's pandemic and my dog is barking and my little sister is walking here, like trying to yell at my mom for something, right? And then you have Netflix on. Your phone is going off because a new highlight of a basketball play just popped up, and you have your headphones on listening to music. How in the world can you focus?
Right.
You can't.
You can't.
That's impossible. And it's impossible by design. And I'll even, put this plug in. Most smartphones now have a healthy well-being side. Like, hey, go ahead and put a night timer. Go ahead and put this is a time to turn off notifications. And you realize that when a tech company is putting that on their product, that affects their bottom line in a negative way, right? Because they make money when you're on it. So when they're putting this on to stop you from being on, they themselves know that this is a problem.
Oh, absolutely. Anybody who ever has looked at their screen time, at the end of the week, and it tells you how long you've been on social media or entertainment or whatever, it's astounding.
Yeah.
and if you think you don't have time for other things like the exercise that might help your mood and attention span, or the, whatever it may be, the meal prepping that would help you feel better, or different things like that. Just look at your weekly screen time report and then, tell me you don't have time.
Exactly. No, and I think, part of health and, well-being is just being honest with yourself, right? Like truly understanding your current situation. We talk about AA and stuff. Like the first step is to realize there's a problem, right? Realize, and it's maybe our environment. The good news is, like we talked last time, we are in control of our environment. Maybe not 100%, but we can turn off things, and there's a lot of things that we can do that we'll probably wrap up the podcast on, of things that we can do apart from medication. And again, this whole thing, we're not saying ADHD is not real. ADHD is very, very real. But sometimes distinguishing between what's ADHD and what's distractions, because our focus, like if our focus really is 7 seconds, then is that still true ADHD, or is it true that we just can't focus
anymore? Yeah. And I mean, diabetes is a very real disease, but did we see it as frequently 30 years ago? No. But what has changed? We're more sedentary. We, eat very differently. There's way more processed foods, things like that has made the environment very, it just leads to the perfect storm for diabetes. It's not that suddenly everybody's just discovering they're diabetic with no external factors that have influenced it.
Correct.
Same with ADHD. Yeah, you may have all the characteristics of ADHD, but how much of it is just our current environment, our lifestyle, and how much do we need to really focus on those things in addition to whether or not we need medication?
Exactly. Which, Melissa, let's talk about that.
Okay.
Because you actually brought a test.
Yes. Yeah. So we'll, let's do some of the questions that is just in kind of a routine standard ADHD test. Okay. And we'll see if we have ADHD right here on the air.
There you go.
Okay. So first question.
Okay.
Often fails to give close attention to details or makes careless mistakes in schoolwork, work, or other activities. So, for example, you may overlook or miss details. Sometimes your work is inaccurate.
Yes.
Check.
Check.
Okay. Often has difficulties sustaining attention in tasks or play activities. So, for example, you have difficulty staying focused during lectures. This is a true question to see if you have ADHD.
Yeah.
Or during conversations or lengthy reading.
Mm-hmm. All right. See, okay, let's pause there, Melissa.
Yeah.
Like we just brought up, I can't even watch Chopped and go on commercial break without pulling my phone out to check Twitter. And it's within the first 15 seconds. But
that's just how we're now programmed. We have had such constant stimulation that we don't know how to just not be stimulated.
Just to be, yeah.
So yeah, that just because you're bored in a lecture.
Correct.
Yes. Okay.
Yeah. And again, like speaking of your watch, I mean, so many times we'll be talking to a patient and their watch will vibrate. And like you said earlier, how can you hold it long enough to talk to your physician without checking your watch to see what that notification is?
Or can you wait until the end of our 5-minute conversation and then check it once we've left the room?
Exactly.
Yeah.
Yep. So I would say yes on that too.
Okay. And number 3, often does not seem to listen when spoken to directly. So it feels like your mind is elsewhere or even some absence without any particular distraction. So do you feel like you have trouble?
Girl, I think if you ask my wife question, she'll say, Tim never listens to me. Yeah, I mean, you know, I'll tell you a funny, the other day I was brushing my teeth. You know, and of course you have the little robot automated toothbrush, so you hear the bzzz in your head. And my wife was trying to talk to me, but she was walking into the closet, and I have no clue what she said. You know, and at the same time, my kids was like, "Dad, I need something." I would say even on that, we have some level of that, but I think for that, it was just chaos in the house.
Yeah.
Which anybody who has kids realizes that's how it is.
Yeah. And I think in a lot of conversations, we'll start thinking about our reply or even thinking about other things that aren't even related to the conversation. You're like listening to the person, but you've got, 5 different things that you need to be doing. And you're like, okay, as soon as I'm done with this, I've got to go do this. And it's just that constant having things that we have to do.
Oh yeah. You should see Jen make an itinerary for me when it's time for like ballet practice and soccer and we have a meet here and don't forget pick up him this and we have a Kroger pickup at 6. I mean, and I'm like, just text it to me.
Yeah.
Just, when I'm supposed to be
like
somewhere.
make a list,
Make
right?
a list,
Because if you're going to be responsible for those things, you're going to have to write it down or, put it in your phone so it can give you a notification later.
Right. That's right. Like, hey, Google. Oh, no, my phone's going to go off. So.
All right. Often does not follow through with instructions and fails to finish schoolwork, chores, or duties in the workplace. So, for example, starts a task but quickly loses focus and is easily distracted.
Oh
I hear this all the time, especially women with the starting tasks. So they're like, I was doing laundry and then I remembered that I need to grab the kitchen towels to put in the laundry.
Yep.
So they go to the kitchen and the sink is full of dirty dishes. And so then they start loading the dishwasher and then they're like, oh, wait, I never did start that load of laundry. Let me go do that now. And then they go to the laundry room, get distracted by something else, and they think they have ADHD and need Adderall for that. But I mean, really, like that is normal behavior.
That is normal behavior. And I think, right. Again, this is trying to tease out, this is, what is true ADHD? And then this is just how life is right now. And I will literally be folding towels and the kids are like, hey dad, can you help me? I don't know how to do this. And I'm like, okay, yeah. So I'll, stop there and I'll go help him and I'll go over his homework. And I'm like, what, you missed this? And so you start sitting there and you're spending time with their homework. And then, it's time for bedtime. And then you go and you get them changed and this one. And then you're at the end of the day, you're like, I didn't even put like, I'll have folded towels sit on my couch because I totally forgot to take them and put them in the, but that's just what happens when you have craziness.
Yes. So check. So you're already at 5. All you have to do is get 6 and you have 8. You have impaired functioning. Okay. So let's see here. Often has difficulty organizing tasks and activities. We talked about that. Your task list and get kids to activities.
Yes.
But yeah, being messy or disorganized.
Yeah, just
has,
like on my desk.
has poor time management, fails to meet deadline.
Yeah.
So
I'm always late.
Okay. Avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. So that's kind of like procrastinating your schoolwork or your homework. For adults, it might be avoiding completing forms or reviewing lengthy papers. Yeah, I think that's everybody.
Yeah, I had a patient today said, and he's in college. And he's like, yeah, sometimes I'll waste 3 hours on TikTok. And how many of us have not wasted time on Instagram? Because look, if you're going to work on a college paper, or you can watch people do dumb things on Instagram, which one are you going to, you're going to choose dumb things on Instagram. Yeah. And that's just because it's more fun to do things like that. And some of it might be addicted, because those apps are made to be addicting. But that, I don't know. When you read that, you're like, doesn't everybody struggle with that?
Yeah. And I'll notice even, when we're working, I'm, charting or whatever, I'll get a notification on my phone, say it's a text message that I need to reply to. But then when I open my phone, I realize I still had an article or Instagram or something pulled up. And I'm like, oh yeah, I was looking at this. And then I'm like, oh wait, the whole reason I was on my phone was to reply to this text message.
Correct.
And then either way, I'm still not finishing what I was doing to begin with.
That's right. Yeah.
So it's just,
exactly.
just constant.
And it's funny because sometimes we'll say things, I just need more hours in a day. We actually don't need more hours. If we have more hours and no plan, we just waste more hours.
Yeah. That's what we talked about with the screen time. Yeah. Just look at where your hours are really spent. But yeah.
All right.
Okay. All right. Just a couple more. Often loses things necessary for your tasks or activities. So you might lose your school papers or your wallet or your keys or your glasses or your phone. Have you ever been walking around holding your phone going,
yes.
Where's my phone?
Oh my gosh. One time Jen had the baby and was walking around. She's like, where's Josh? I'm like, on your hip. And she's like, oh, he is. And I was like, oh my goodness, we are. Yes, that, I feel like, my wife calls that mommy brain. I mean, the amount of times I like, you'll be like running to your closet because you forgot your keys. And then you're like, wait, why did I get here? What am I doing here? You like kind of walk back and try to jump back in, like try to recreate and anyway, I feel like that's just how it is.
All right. And then easily distracted by outside stimuli. So, might be unrelated thoughts or different things around us in our environment.
Yeah. Or your watch buzzing.
Yes.
Or your phone buzzing. Yeah.
Anything. Okay. Just one more. Forgetful in daily activities. So doing chores, running errands, returning calls, paying bills, keeping appointments. Yeah. So I think that's just about everybody. And so, we both scored for impaired functioning based off of this, which is a very common questionnaire when people are getting evaluated for ADHD. And so based off of this, the person doing the evaluation may then send it to us and say this person would benefit from ADHD medication.
Yes.
And that's all it takes.
That's all it takes.
And so I think that's part of the reason that we've seen that huge uptick in ADHD medications. And then we turn around and start seeing shortages because everybody's trying to get these medications.
Yeah.
And here we are.
Yeah. And I'll even put in a plug while we say this. Some people will say, well, I took one of my friends and it worked. Every person who takes Adderall, it will work. Every single one.
Yeah. There used to be a thing that it would only work for people who truly had ADHD, but that's not.
It's kind of like everyone who takes cocaine will get high.
Yeah.
Yeah. It works.
Yeah. And kind of on that note, Adderall and the medications similar to it are a Schedule II controlled substance. The only thing above that, Scheduled Ones, is cocaine
and heroin.
And heroin. You know, it's like, it is that serious. And so when people are throwing things at the pharmacist because they can't get their Adderall, that shows us we have a bigger problem.
We do.
These are very, can cause dependence, and you know, a lot of people claim that they're not addictive, but with any type of substance, our body will get used to it, just like alcohol or heroin or that kind of thing. So the next time we use it, we'll need more of the substance to get the same result.
Correct.
And so that's the problem with these medications. They might, for the first several months, or if even that long, people think, oh, wow, I can function, I can do all these things. And then they realize, wait, it's not really working all that well anymore. I'm kind of right back to where I was.
Correct.
Then we have to increase the dose. And it's just.
Right. Knowing all along that the we didn't change anything in our environment.
Right.
And so, exactly. Which I guess, you know, wrapping, you know, I guess to the end. Melissa, what can we do?
Yes.
Right? Because let's say, I mean, right, medicine for some people is absolutely crucial. And that's probably why we are also very careful with who we write ADHD medication. And that's why we do visits and urine drug screens, because we want to make sure that there's a role for these meds, but we do it safely and we do it effectively. But if we can't get it because we are short, what can we do to calm some of that down? Kind of like with lifestyle, with anything else.
Yeah. And so in first line, when you kind of look up to date and all these resources that kind of help guide clinical decision making, when we're treating ADHD, it's very a combination approach. So yes, medications, and in a lot of cases can be helpful for people who are truly struggling with ADHD, but cognitive behavioral therapy is right there with it. Those are like top two. And even when it was talking about medication options, the stimulant versus non-stimulant, like one of the biggest advantages of the stimulant is just that it works immediately.
Exactly.
And so you can actually get pretty good results with non-stimulant medication, but you have to take it for about 4 weeks before you notice the clinical change or the difference. Whereas you take a stimulant and you notice it almost immediately, which is also another reason that it's highly, potentially addictive dependence, inducing. So.
Exactly. Yeah. And so again, we always talk about here, our approach is lifestyle is just as important as medication. Cognitive behavioral therapy, which we, hopefully 2023 we'll get a special guest who is a specialist.
Yeah. I would like to have a deeper discussion on that. And that cognitive behavioral therapy is really beneficial not only for ADHD, but other anxiety, depression, all kinds of.
Exactly. Yeah. The whole concept of it is try to retrain your brain how to think things through. And exactly right. We can train our muscles to run a marathon, right? We can train our body to do all sorts of things. Doesn't mean it's easy, right? You got to do that 14-mile run on Saturday. You've got to do the 20-mile run. You got to drive. So it's not easy to train your body to do those things. But if you want to, you can. Well, it's the same with, attention. Right now, by design, our attention is down to 7 seconds. It's not a genetic thing because genetics don't change that fast. It is truly an environmental change thing. But with that being said, we can train our brain to focus and train our brain to think, right? So, cognitive behavioral therapy, mindfulness, meditation, even just sitting, we talked about this earlier, just sitting on a park bench and let's, put your phone on a timer and just close your eyes and just breathe. And see how long you can do that before you're like, wow, that's a long time. And then look at your phone. And oftentimes it's like, oh, it's been 7 seconds or 15
it's
seconds.
Like, oh yeah, maybe 30 seconds.
Yeah.
But yeah, seeing if you can do that first of all, but then maybe each time you do it, increase that time a little bit. So maybe you start with 30 seconds, but then the next week, give yourself a 1-minute timer and just sit there.
Yeah. Just be.
With your own thoughts. It's a type of meditation where you're just sitting in stillness.
Yeah. And that's part of training your brain. That's part of training your brain to focus, training your brain to pay attention, and a lot of, other cultures, they do this regularly, and this is something that we can do now. Yeah, you can practice now, to try to help mentally increase your attention span.
Right. And it gets you into that or out of that comfort zone. So the reason that we're constantly looking at some sort of phone or whatever the case may be, we can't just stop. As we kind of do those practices, those mindfulness practices, meditations, it gets you more comfortable with the stillness. So if there is a commercial break, you can sit through it without having to pull out your phone and scroll just to pass the time. Exactly. You can just sit there.
You could just sit there.
Or you can get up and get some steps in.
Yeah.
I don't know. Whatever you want to do.
Yeah, exactly. And which I guess brings, talking about phones brings to our second thing really is turning off your phone. Turning off your notifications, even practicing having periods where you don't have any electronics on. Maybe you say, okay, my morning when I wake up, my phone is off. So I use a traditional alarm clock like back in the day. And for the first 30 minutes, I'm going to journal. I'm going to read a book. I'm going to have my coffee and just sit there in quiet. That actually is a really, really good practice to just, again, start working on changing your environment. Maybe that's the time where you start writing down your goals for the day, your schedule for the day, to help your brain have something it can focus on and work on.
Right. And having that plan and structure is really important when you're dealing with ADHD or any type of focus problems. So setting those reminders for yourself, setting a schedule for yourself and trying to stick to it, knowing the tasks that you have to complete that day and make yourself an actual old-fashioned checklist. And once you're done with it, check it off. Whatever works for you, but just having that structure and something to, tick through those things will help you finish those tasks.
Sorry, I drink my water.
That's okay.
Yeah. Okay. Yeah, exactly. And I think that's awesome. Another one I think people don't often consider, but it's exercise. We aren't designed to be sitting still all day long. And so when that happens, you have a lot of nervous energy. That fight or flight stress, because you've been under stress all day from work. We've got to release that somehow. And if you don't release it, the attention is just not going to be there. So exercise, actually data-wise, exercise has really, really good data for attention and ADHD.
Yeah. Like you were talking about that extra energy that we don't expend on a regular basis because like we've talked about, we're sitting a lot throughout the day. We actually don't even have to leave the house to work or to get groceries or to do anything. And so if we're not getting up, expending energy, it affects our mood. It affects our ability to focus. So even taking small activity breaks through the day can help. So whether that's getting up from your desk for even 5 minutes or less, making sure you are getting some formal exercise in there as well can help your attention span.
Yeah. And even in those times, maybe you put that as that is your social media time. Right. So you're not constantly scrolling. You'll know that, hey, the last 10 minutes of the hour, I'm going to go on Facebook or Instagram. That's my time to watch YouTube videos, whatever. And then when the time goes off, then you go back to work. Being structured like that actually is really, really helpful for people with ADHD and without ADHD.
Yeah. I think we all need the structure like we talked about. Even if you don't have ADHD, we are just in an environment that makes it difficult to focus no matter what the circumstance. So having that structure, keeping those daily habits, whether it's schedules or that morning meditation or quiet time or your regular exercise and activity. Healthy diet is a big part of it too. If we're running on caffeine and sugar, we're going to be constantly crashing, not going to be able to focus. Or that caffeine may help us just temporarily, but then we crash and we have to do it all over again. So making sure that we have good, healthy diet, plenty of water, all the things that we know we need.
Yeah. And sleep, we can never forget sleep, and I've had some patients, they can't focus because they're sleeping 4 hours a night. And that's not possible. Even in healthcare, we realize like with healthcare, they stopped doing those long calls because we realized we were actually practicing healthcare impaired when we're not sleeping because you can't focus, you can't think. So that's an often neglected thing here in in, I guess, our culture now, we just sleep when we die, I guess.
Yeah. And when we have access to things at all hours of the day too. So it used to be where, you know, your primetime show ended at 9 o'clock. Well, that was all you really wanted to do for the evening, and you might as well get ready for bed because you're not waiting up for the 10 o'clock news or whatever. But now all you have to do is hit next episode.
Yep.
And so we have constant extra things to do when we should be sleeping. And so making sure that you are setting a bedtime can help, because even that one extra hour of sleep or lack of can make a huge difference in how well you can focus the next day.
Oh, there's no doubt. So, yeah. Well, Melissa, that is a phenomenal list. Any other ones that we've missed?
I think that covers it. We've gone a little over time, I think, and we'll have to break up this episode a little bit. But I think we hit a lot of high points with ADHD and good starting point.
I agree. Yeah. So, you know, kind of wrapping everything up, you know, ADHD is a big issue. It's probably a lot more environmental now than true ADHD, but getting tested is not a bad idea. But just because you get tested, you know, you kind of just have to understand, you know, I guess we talked earlier, being honest with yourself. Like, this is my situation right now. How much of it is true ADHD and how much of it is just my situation is horrible?
Right. And I think especially the adult onset. So we'll all the time have people in their 30s or even 40s newly diagnosed with ADHD. And they may say, yeah, you know, I recognize these symptoms now from childhood. I'm like, well, how did you make it to age 40 then without medication and you need it now? Well, when they were a child, they probably didn't have the number of distractions that we have now. Their parents made them go to bed at a certain time. They had schedules. And even their early adulthood, they made it through. They've had jobs, they've had relationships and things like that. And if those things have been managed pretty well up to this point, we may not have to add medication, but maybe just looking at how life is different now versus, you know, 10, 15 years ago and seeing what things that we can improve from a lifestyle side of things.
Yeah. And really, you know, when we gave all those tips, it just sounds like things that your mom would say, right? Like, go to bed on time.
Eat your vegetables.
Eat your vegetables, right? Go outside and play.
Get some sun.
Get your sun, right? And, you know, they will make us like, hey, this is the time to do homework. This is time to, you know, do all that. And like you said, we used to have society make schedules for us. We don't have that anymore. But, you know, this is, again, the point of this episode is these are things that can make the medicines work better if you're on it, or things that you can do so that you don't even need medication. And again, it's just something really good to think about, because I often hear patients say, you know, I don't want to take any medications unless I absolutely have to. And they're usually saying that about blood pressure or cholesterol medicine. But I think that same energy needs to be applied to lots of things, you know, ADHD, you know, and multiple other things. We don't need to use medication unless we absolutely have to.
Yeah. And medications have risks as well. And like we talked about, they are a controlled substance, but they can also contribute to higher blood pressure, higher heart rate, heart arrhythmias. They can affect appetite, so many different things. They can affect sleep. So if you're already having trouble paying attention and then your medicine makes it to where you can't get a good night's sleep, you're going to even have a harder time.
Correct.
And need more medicine to get through the next day, you know.
Struggle.
Yeah.
Well, Melissa, we did a thing.
Yes.
This has been fun. And I think this is important. Now, starting next year, I guess it'll be 2023 when we start more episodes. We will touch base on things like blood pressure, diabetes. And maybe we poll the audience. What do they want to learn?
Yeah. Get some topics for the new year.
Awesome. Well, Happy New Year to you, Melissa.
Yes, you too.
And thank you to our listeners for supporting us for 2022. And we hope to continue 2023.
All right.
All right. Thanks, Melissa.